When I was about 20 weeks pregnant, an ultrasound was done, and we found out at that point that my daughter has rhabdomyomas.
Cardiac rhabdomyoma, which is a lesion within the left ventricle of the heart. And then Raquel developed severe preeclampsia. It's a multi-organ disease. If it's not treated, it can cause maternal and fetal mortality.
We received a phone call from Samantha's friend saying we were in an accident. We heard the sirens, and we just followed the sirens.
She came by helicopter from a crash that took place 40 miles away from Christ. When she came here, she was really in very critical condition. We were very concerned about whether she would even ever wake up.
Well, there's a priest waiting here for us, so we were very scared.
Yeah.
We ended up having to deliver Raquel's baby at 33 weeks, so which is 7 weeks early.
There was a very high chance that she wouldn't survive, but she did. She beat all of the odds. It was just like, oh my God, okay, so she's gonna be normal. She's gonna be fine. She can grow up, she can play, she could do this, she could do that. I was like, okay, that'll work for me.
Samantha was in a coma, but over the course of her stay, she gradually woke up.
I remember that everybody that came in the room was like really happy, and they were like treating me like a part of the family.
They treated her like she was their child, from the nurses to the doctors.
And the first thing that the nurse, Jill, who was tending that night, said was, I believe Sam's walking out of here. And while we were gone, Jill did Sam's hair and did it in a French braid and shampooed it and cleaned her all up. And we came back the next morning and saw this beautiful daughter. And I hope for the rest of my life I retain the gratitude that I felt that morning.
We provide highest level of care in this area, care that people can't get at other hospitals. But we've always suffered from the fact that we do it in a relatively small space. And it becomes a problem. Many times we've had to go on bypass and couldn't take a patient like Samantha. That would be a shame, because it could have led to a worse outcome.
If our daughter didn't come here, she very well could be in a nursing home right now.
Or worse.
Or worse.
The ED was built for 55,000 patients. We see 100,000. The ICUs run at 100% capacity every day here. And we have turned away every year thousands of inpatients. Cannot get them in the door. So the next two projects are going to fix both of those issues. The new bed tower, which is being built today, will add 72 new ICUs to the campus. Total net gain of 140 beds.
It's extremely exciting because we would have the ability to grow our services, and we hate to turn any patients away who really have the need to have good prenatal care.
We are the high-risk perinatal center for the entire Southwest Chicago region. And the new patient tower with our new labor and delivery unit will afford us increased operating room space, increased labor and delivery space, and increased space for our high-risk mothers.
The ED will also be expanded, so patients can get into the ED a lot quicker.
It's going to allow the emergency department to more than double its size. So these issues of not having a bed for a patient or having long waits for patients to get care, that's going to become something of the past.
This is a $650 million investment, so we need philanthropic partners to help us get there, and so they play a significant role in us achieving our vision and our mission.
Philanthropy is the lifeblood of any hospital. Philanthropy allows us to provide critical patient services and the best care for women and their infants here at the medical center.
And so it's really critical if people want that service in their community that they be willing to help.
So folks in the South can stay in the Southland for their care, making it a lot easier for them, their loved ones, to access care at a very high level close to home.
Now I'm in a program to become a yoga instructor, so hopefully I can help others who are trying to recover. I want to hold someone's hand and let them know that this isn't the end of your life, you know, there's hope.
In the future for Samaya, I just look forward for great things. I look forward for first day of school. I look forward to seeing her off to prom, eventually college, a wedding, just watching her grow up and for her to be healthy.